Okay, students. So today we will discuss about the intermuscular spaces in the upper extremity, that is in the scapular region. So let's start the topic. There are three intermuscular spaces in the scapular region, and depending upon their shape, they are named as quadrangular space. This area, this yellow color area, what you are seeing here, it is quadrangular space, and then you have the one upper triangular space and one lower triangular space. In this diagram you are seeing the scapular region from the behind, because here you can see nicely this is the spine and the acromion process of the scapula. So this is the posterior view of the scapular region, where you can see three intermuscular spaces. One is quadrangular space, one is upper triangular space, then you have the lower triangular space. So we will discuss the details of these intermuscular spaces, the boundaries, and what are the content of these spaces, because this is very important for your professional exam as well as your NEET PGME exam. This is often asked in the form of short notes, and there are so many multiple choice questions based on these spaces in your PGME exam. Coming on to the quadrangular space, so this you can see here, this yellow color area, the boundaries of this quadrangular space. If we see superiorly, from anterior side there will be subscapularis muscle, then you have all around the capsule of the shoulder joint, then from behind you will find the superior boundary is this quadrangular space is formed by teres minor muscle. Then if we see on the inferior boundary is formed by the teres major muscle. This muscle, whole muscle, is your teres major muscle. The part of the teres major muscle here, it is forming the inferior boundary of the quadrangular space. Then you have one medial boundary, one lateral boundary. The medial boundary is formed by this long head of triceps muscle, and the lateral boundary is formed by the this surgical neck of humerus. And then we have the contents are basically axillary nerve. This is axillary nerve. Then you have posterior circumflex humeral vessel. This is the artery, and this is the vein. So these three content you have to remember, which is present in the which is present in the quadrangular space. The second intermuscular space is the upper triangular space. You can see here, this is the triangular in shape, and the boundary of this upper triangular space is formed by, you can see here, the medial boundary is formed by the teres minor muscle. Then the lateral boundary is formed by long head of triceps, and the inferior boundary is formed by the teres major muscle. So this is the boundary of the upper triangular space, and the content you are seeing here, this is the circumflex scapular artery and circumflex humeral vein. So this artery and vein, the circumflex scapular artery and vein, is the content of the lower triangular space. Moving on, the lower triangular space, you can see here, this triangular space is the lower triangular space, and boundary you can see the medial boundary is formed by the long head of triceps. Then you have the lateral boundary that is formed by the medial border of humerus, and then the superiorly there is teres major muscle. The content is, you can see here, the radial nerve, and then the profunda brachii vessels, the artery and the veins. Profunda brachii, artery and the vein, these three are the content of the lower triangular space. So this is all about the intermuscular spaces in the scapular region. So please revise it. It is very important for your professional examination. Thank you.